Welcome to another episode of What Did the Patients Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi everyone, welcome back to another episode of What Did the Patient Say with myself, Dr. Lauren Brindisi with Carolina Functional Neurology Center. And today we're here to answer the question that we get so often, which is, what is a neurointensive program and why should I do it? So let's start by talking a bit about what a neurointensive program is. Why do we even offer this option at our clinics? So a neurointensive program is designed for patients, especially from out of town or who have really busy schedules and really can't get to the office several times a week. So what we do is, say somebody travels from California. They'll come, they'll hang out with us for 4 to 5 days usually, and they're actually seen multiple times a day during the course of that time. So with our neurointensive programs, what we offer is usually 3 visits per day for 5 days. And in this time frame, we're able to make a lot of change in patients' neurological symptoms. And why is this? Because of neuroplasticity. So neuroplasticity is the brain's ability to change and respond to our environment, so to grow and adapt and to learn based on the things that we're doing. And when we work with patients, of course, we see people across the neurological spectrum who are struggling with pretty severe neurological symptoms. And it's important that in order to create this neuroplasticity, we need repetition, repetition, repetition. And so these neurointensive programs are designed for you to come and be immersed in your healing process. To come in, do multiple treatments a day, and we just repeat the same things over and over and over, and we continue to mold and adapt what we're doing in the office to continue to make it more challenging for the patient based on their individual needs. I personally love the neurointensive programs. I feel like we're able to make a lot of change in a very short time for patients. And my favorite part is we get to run diagnostics on the first day, and then we get to run diagnostics towards the end of the week, and we get to show people all the profound changes that their brain has made in just a short period of time. Now, this doesn't always mean that it's immediately going to translate into you walking out the office after 5 days and feeling better. But what this does mean is that we're moving the needle in a better direction. And what that usually means is things like the frequency, intensity, and or duration of patients' symptoms start to lessen. And this is important to understand because just coming and doing an intensive program doesn't mean you're going to be cured, but it's a huge step in the right direction. And from there, we're able to start working with patients via telehealth to help continue to move that progress forward. We get to spend a lot of intimate time with our patients who come for the intensive programs, and so it really does help us better understand what's going on with that individual and what their specific needs are and how their responsiveness to treatment is going to be. And that really helps us better understand what that long-term prognosis looks like. And are we going to be able to not only make change in the short term, but are we going to be able to come up with a plan to make change in the long term? And I will say the latter is what happens for the majority of people that come into our practices. We are able to work with them, and usually we follow up via telehealth, and that starts maybe every couple weeks, and then we go down to every month. And then we just keep spreading those out so long as the patient is continuing with our at-home recommendations and continuing to become self-sufficient in managing their symptoms and continuing that healing process. Again, when we go back to this idea of neuroplasticity, it's very important to do repetition, repetition, repetition. And so when we send homework home, and then the patients are doing those things multiple times a day, just like you might brush your teeth or eat a meal several times a day or take supplements or medications. You'll also be prescribed neuro rehab strategies to help continue to create neuroplasticity and build strength within your nervous system. And this is the way that we're able to make lasting change. So, during that neurointensive program, we also get a lot of questions about, well, what are we going to do in this time frame? And so let me walk you through kind of the generic idea of what a neurointensive program week would look like. So somebody, again, flies in from California, they get a hotel, they get an Airbnb nearby the office, they come in maybe over the weekend, get themselves settled in. We encourage that. Don't just show up on Sunday night and then roll into treatment on Monday. You maybe come Saturday, give yourself a little time to acclimate, especially if you're coming from a different time zone. We see people who not only come from different parts of the United States, but from all over the world. And so Monday morning is when we kick it off. We start with our examination, just like we would do with any new patient that comes in. And we are going to do a very detailed functional neurological exam. We're going to assess things bedside from top to bottom in your nervous system. Let's just understand what's going on with the function of your nervous system and how well the different areas are doing. We will test autonomics, we will test cognitive function, we will test motor coordination and timing and rhythm, sensory examination, cranial nerve examination. We'll look at, like I said, autonomics. One of the big things we do with every single patient coming in, whether they have an autonomic disorder or not, we are going to look at vitals, seated, lying, and standing. This is a staple for functional neurologists because we need to understand the capacity of your nervous system. It's very important when we're coming up with a treatment plan that we understand what's called a patient's metabolic capacity or their central integrated state, meaning how happy is your nervous system? Is it ready to go? Are we able to push you? Or is your nervous system really sensitive and we have to take things a little bit more low and slow and passive? And an assessment of vitals, lying, seated, and standing, does give us a lot of information about the integrity of the autonomic nervous system and potentially how those fuel delivery mechanisms are working and how much we can really push the throttle for a patient that week. And there are other things that we're assessing throughout the exam to look for neurological fatigue and coming up with not only what types of therapies are we going to do, but how complex are those therapies going to be. And we tailor the treatment for the week based on everybody's individual needs. It doesn't matter if you both come in with POTS or two people come in with concussions. The treatment plan is not going to look exactly the same. And this is so important to understand whether you come to see us or you go to some other rehab facility because you have a neurological condition. Your metabolic capacity and your central integrated state of your brain is different from everybody else's. And there are a lot of factors that contribute to that. For example, women, it's going to be different. Our central integrative state of our brain might be different at one time in our cycle than the other. Or did you get enough sleep or not? What does your diet look like? How is your stress management? Do you have other comorbidities? There's a lot of factors to take into consideration. And we see people across the spectrum who are high functioning athletes and CEOs looking to just enhance their performance to people who are bedridden. And we are still able to do these neurointensive programs with patients on either side of this spectrum. And that's important to understand because we get a lot of questions about, well, is this right for me? Am I going to be able to do a neurointensive program? This seems crazy. I can't even get out of bed. How am I supposed to come and get to the office and be seen several times a day? And this is what we'll walk you through individually so you understand what your central integrative state is, what your metabolic capacity is in that time, and how we're going to meet that need even as it ebbs and flows throughout the week. Then, after we do our bedside exam, we're going to run diagnostics. We have a variety of diagnostics in our offices that help us look and evaluate the function of somebody's brain. So just like an MRI gives us a really good picture of somebody's brain, it really doesn't tell us what we need to know about the function of their brain. The majority of people that we see who come into our offices have already had MRIs, and they are completely normal, yet they are extremely symptomatic and having a lot of neurological symptoms that are impacting their day-to-day. So the 3 diagnostic tools that we use in our office is something called video oculography or video nystagmography. These are infrared goggles that we actually are able to put on, and we're able to measure and quantify what's going on with somebody's eyes. And this is extremely important, and if you follow us online, you probably have heard us talk a lot about eye movements. Eye movements are one of the best ways for us to understand the function of somebody's brain. And why? Because eye movements require the use of all different parts of the brain to be able to do that. And so our doctors have extensive training in clinical neuroscience in understanding the pathways that are utilized to do different eye movements. And so when we look at video oculography videos and reports, we are able to use that diagnostically and cross-reference with our bedside exam to be able to triangulate where the problem lies in somebody's nervous system. And that can be very different from one person to the next. But we want to be extremely thorough, so we don't just rely on one diagnostic. We use a multitude. And so one of the other ones that we run is called computerized posturography. Our ability to stand up and be bipedal is profound. It is something that no other creature on this planet does. And it was one of the major driving factors for the continued development of our brain to really set us apart from any other living thing on this planet. And it's a very complex thing that we do to be able to stand. And a lot of us take that for granted. But we see a lot of people who come in wheelchairs, who have trouble walking, who have difficulty with their balance, who get dizzy when they stand up, who are passing out, who have weakness in their legs. And there's nothing wrong with their legs. It's how our brain controls and regulates our balance. And we use a lot of different pathways in our brain and a lot of different sensory systems for us to be able to not only stand, but to maintain our balance, to understand where we are in space and where space is in relation to us. And this is all extremely important, and we challenge that in different ways. And what our brain should be able to do as we challenge our balance, like close our eyes or get on a foam pad where the surface isn't so flat and it's a little bit unreliable. How about if we turn our head and close our eyes? Can our brain rely on different sensory systems on their own without changing our stability? And so the 3 we really look at when we're assessing balance is our visual system, our balance centers, so our vestibular system, which starts in our inner ear, and then the information from our joints and muscles, or what's called our proprioceptive system. And these 3 play a really key role in the integration inside of our brain. They work together to allow us to know where we are in space and where space is in relation to us so that we can move around properly without feeling unsteady, without feeling dizzy, without falling over, without feeling extremely fatigued and weak. This stuff just happens automatically. And when you have a neurological condition, these systems can be impacted in very individualized ways because the integration of the information can get skewed, and it can be challenging for your brain to do that, and that can be extremely tiring. And so this diagnostic allows us, again, to evaluate these systems in a lot of detail. We actually run 8 tests just on the balance plate, and it gives us a ton of metrics about things like center of pressure, about fatigability, adaptability, stability scores that are age and height matched, and the list goes on. We can look at sway patterns. We can monitor what someone's balance looks like. Do they have a head tilt? Are they slumped over? Are they leaned back? Are they leaned forward? Are they leaned to the left? And this all gives us little nuanced details about how their brain is perceiving where they are in space. And then the last one that we do is called interactive metronome assessment, which we use the interactive metronome assessment not only as a diagnostic tool, but we use interactive metronome as a therapy as well. But we do use the interactive metronome assessment because it gives us a lot of details about someone's motor coordination, their motor timing, their auditory processing, their rhythm, right? Can you keep a beat or not? And it actually breaks this down into milliseconds. Our brain can't even perceive milliseconds. So it's very interesting to see even musicians who think that they're really on beat actually sometimes struggle with this, especially if they've had something like a head injury or developed another type of neurological disorder. And they go from, being a musician and being able to keep rhythm really, really well to struggling with these things. And so we don't just have them clap to a beat, but we have patients, they clap with both hands, they clap with their right hand on their thigh, on their left, they use their left hand, we do both feet, we do one foot at a time, and then we actually look at cross chord mechanisms. So you have to dual task your right hand and your left foot. And again, as we challenge these systems, we get a lot of information if something breaks down. Or are they better with their right hand versus their left hand? Are they having trouble with dual tasking? Is that where the system breaks down? And this gives us these metrics, and we get task averages, we get percents of how early or late somebody is. For example, patients with Parkinson's, we often see that they're way too slow. And so we do things to work on this and speed this up. Or our little kiddos with ADHD, right? Their brain's just moving so fast. And so what we'll see is instead of being able to keep the beat, they're like clapping really, really fast. And that's actually what they're perceiving, right? That's how fast they think that it's going. And so then we take all of this information, and it's all happening in real time. We are trained to see these things and understand what's going on so that we can, again, triangulate where in the nervous system that needs the best support. And then how are we going to drive a treatment plan, just like physical therapy, but for your brain. So we're going to exercise these areas, and we're going to work to create positive neuroplasticity that helps to improve the stability of your nervous system to make long-term change. And where does the long-term change come from? Just like I said before, repetition, repetition, repetition. So we just jump into treatment that afternoon. And patients are usually seen 3 to 4 times a day for the rest of the week. And so we get going, and again, it's physical therapy for your brain. We have all sorts of tools in our office that allow us to exercise the nervous system and make it stronger. Just like if you were to go to the gym and you exercise your muscles and they're going to get bigger and stronger and more defined. It's kind of what happens in your brain. You just can't see it. But we have all of these metrics and objectives at the beginning of the week, and then we rerun them at the end of the week. And then the goal is we've started to move the needle in a better direction. We spent a lot of time with you so we can understand your responsiveness, your central integrated state, your metabolic capacity. And then we start talking about what does an at-home treatment look like. And we do our best to kind of package that up into a pretty bow and send you home with therapies to do. From there, we'll consider what other resources do you have at home? Can we help to co-manage with your other providers or other providers in your area that may have resources that we think would be beneficial for your brain? And we're going to help you facilitate that. Our job from there is to continue to not only help you get better with the strategies we've provided, but to help you get better with resources in your area, but hopefully you don't have to figure that out on your own. You've got a doctor who's going to be there to listen and understand, and who is a specialist in understanding what's going on with your nervous system and what types of treatments would make the most sense. So, I've said a lot about neurointensive programs. You guys can probably tell I'm very passionate about it. Before I even went on to study clinical neuroscience, after I graduated chiropractic school, I studied neuroscience, behavioral neuroscience in undergrad. And I am just so honored that I get to do this work every single day and that I get to help patients make this kind of plasticity in their nervous system. And it is, I can't say a miracle anymore. And Professor Carrick would always say, these are not miracles, these are clinical expectations. And at this point, it is a clinical expectation that we see you start to get better and move the needle forward. And if you're not getting better, we're missing something, and we're going to do every single thing that we can to try to support you in getting the help that you need. The majority of people we see begin to get better. And again, that might not happen overnight, but with repetition and time and resources and support, healing is possible. So if this is something that interests you, I strongly encourage you to reach out to one of our offices and talk to one of us. Talk to one of our doctors and see if we think this would be a right fit for you. Does this make sense? Is this something that you're open to doing and willing to start this journey of healing naturally? Thank you guys so much for taking the time to listen, to learn more about these neurointensive programs. You guys are driving the videos and responses that we provide. People deserve to have these answers and deserve to know that there are treatment options like this out there. So if you have any other questions for me, please comment, like, share. If you have a family member who this you think would resonate with, or a friend, please share this information. This is how we get functional neurology into the mainstream. Thank you guys so much, and I look forward to talking to you again soon.